My patient was a 59-year-old Caucasian woman who was admitted on 4/8 with abdominal pain that lasted for 3 weeks, but on the same day she had a laparoscopy diagnostic and converted open with small bowel resection the same day. She was on an MPO diet, but this morning on Monday when I was in A2A, her diet changed to a liquid diet from the doctor. Some subjective data from her. She said, I am in 6 out of 10 pain. I am having pain in my head consistently. I want some pain medicine. And she also said, I feel like I need to pass gas, but I haven't yet. Some objective data is her weight was 106. Her white blood cells were 10.6. Her red blood cells were 2.92. Her hemoglobin was 9.0. Her hemocrit was 28.2. Her sodium was 135. Her potassium was 4.0. Her chloride was 104. Her BUN was 2. And her calcium was 8.1. Initial findings. My patient was in her room laying in her bed and was in 6 out of 10 pain. She was drowsy and sleepy, but when talking with her, she was alert and oriented times 4. All she wanted was to rest, but I had to administer her meds so she could be more comfortable and have a pain level that would be decreased. She was not talkative in the morning when I first assessed her, but after she got rest, she was up and ambulating by herself and more talkative to the nurse and myself. So prior problems would be risk for pressure ulcers, fall prevention, and impaired skin integrity. Patient scene. The patient will clean surgical incision, clean, dry, and intact. She will keep that on a regular basis. The patient will eat 50 to 75% of her meals. Patient will understand the need to clean surgical incision to decrease infection. Patient will call if need for assistance. Patient will report pain at affected site. Patient will maintain safety to decrease injury to self, and patient will reposition self in bed. And also, patient will ambulate when wanting to. Intervention needs. Nurse will monitor site for impaired skin integrity daily for color changes, redness, swelling, warmth, pain, or other signs of infections. Nurse will maintain the bed in the lowest position and lock in for patient safety. The nurse will instruct patient to reposition in bed to prevent pressure ulcers and to ambulate to increase blood flow to legs. The nurse will also promote safety. Everyone's emotions. The nurses were very informative, trustworthy, and helpful with tasks, especially my nurse that I performed with her today, which was a dressing change on JP drains. She watched me perform the skills and gave me positive feedback. She was also happy that I informed her of everything I completed with my task with medications, assessment, emptying the JP drains. My nursing instructor was very positive and helped me through my task with administering medications. My patient was nice, drowsy, and sleepy in the morning and when administering meds, but during lunch she was awake and more active and talkative. Some responses and changes to the plan. My patient was very calm, cooperative, and followed all commands I gave her when I was doing med administration and performing my head-to-toe assessment. I wish she could have gotten more sleep during the night from all of her pain with her abdomen and continuous headaches. Changes in the plans would have been more interaction with my patient and having patient education on keeping her incision clean, dry, and intact so no infection occurs. Skills performed. I did a head-to-toe assessment, administered medications, emptied out 2 JP drains, and documented output and color. I also did dressing changes on both JP drains. Effective communication. The nurses had effective communication on the floor today. After handover of report, the nurses communicated with us asking what our tasks were for the shift. The nurses students were very effective on the floor when helping out with tasks and being diligent in learning new skills. The patient was very alert and oriented on the floor, and some call lights went off and assisted with patients. My patient was very communicative but she had effective communication when talking about her pain level and how she wanted to be left alone so she could rest. Differences in the plans with my patient was finding ways that could have helped her sleep better at night so that she is rested for the daytime, giving patient education on cleaning, surgical incision, so she understands what to do when she is discharged. She refused her bed alarms, but trying to teach her to understand that bed alarms is good to know when she is getting up so we can ensure safety. Some pros for my skill performance: therapeutic communication, patient education about medication she was given, removed and remove the dressings from the JP drains and put on new dressings, emptied out JP drains, and measured the output of the drainage. Some cons would be more patient interaction, more patient teaching on how to prevent infection at surgical incision, and patient education about improving nutrition after being MPO. My scenario performance. Overall, my clinical day in A2S was very eventful and productive with all the interaction. I had no doubt myself when administering medications and doing a head-to-toe assessment because I have done it every week. I have been on A2A. I have really enjoyed talking and relaying information about my client to my nurse and my instructor. I believe that I was very efficient on the floor with helping out with tasks, and I also built trust with my patient.